It's hard to believe, but thousands of years ago, one of the most extreme ways to get rid of excruciating headaches was to carefully drill into the skull. This method was called trepanation and was found on almost every continent from South America to ancient Egypt. Archaeologists have discovered tens of thousands of skulls with distinctive round holes that were made using primitive tools, stone knives, and bone drills. The most astonishing thing is that many of these skulls show clear signs of tissue healing, which means that people not only survived such operations, but also went on to live for many more years. In South America, Inca tribes used trepanation not only to treat migraines, but also after cranial injuries to reduce pressure inside the head. In Europe, this method was practiced more than 5,000 years ago. It was especially common in Neolithic societies. The operation was performed without anesthesia, using only herbal infusions to dull the pain, and the edges of the wound were cauterized with hot iron or smeared with a mixture of honey and fat to prevent infection. In ancient Greece, the great physician Hippocrates described trepanation as a method for curing diseases of the spirit. At that time, it was believed that evil spirits could enter the head and cause unbearable pain. To relieve the suffering, the patient was laid on the floor, their movements were restrained, and careful drilling of the skull was begun until a small hole appeared. Sometimes the procedure was performed several times over the course of a person's life. Even in the Middle Ages, when medicine was already under the influence of religion, doctors did not abandon trepanation, considering it a way to rid people of evil thoughts, epilepsy, and sometimes even mental disorders. To this day, scientists still debate how ancient doctors managed to avoid deadly infections and severe bleeding. After all, there was no such thing as sterility in those times. Despite all the horrors of the procedure, trepanation saved many lives and sometimes even worked wonders. After the operation, people really did get rid of headaches and seizures, returning to a normal life. But if this method seems too wild, the following treatments are no less surprising in their exotic nature and mysterious effectiveness. Eastern art of cauterization, the mysteries of moxa and burning needles. After the gruesome rituals of drilling skulls, we moved to ancient China and Japan, where the cure for illness was sought not in blood, but in fire and smoke. Here, knives were replaced by bowls made from dried mugwort, which doctors called moxa. The moxa was heated until it glowed bright red and then applied to specific points on the body that corresponded to channels of vital energy. Sometimes these balls were burned right on the tip of an acupuncture needle so that the heat would penetrate deeper until the patient felt a burning sensation that sometimes turned into real pain. This procedure was considered not just a physical ordeal, as people believed that the smoke and heat drove out illnesses, attracted strength, and even protected against evil spirits. In Japanese villages during the Edo period, peasants would gather together every spring for collective moxibustion sessions. For adults, points on the abdomen were treated, while for children it was the ears and ankles. The higher the temperature and the sharper the sensations, the stronger the effect was believed to be by healers. This method was used to treat everything from colds to chronic fatigue. And if the pain became unbearable, it was thought that the illness was burning away along with the pain. In China, moxibustion was used for rehabilitation after strokes or severe fevers. A description of one such session has survived from the Tang dynasty, when a court physician saved the emperor from paralysis using hundreds of moxibustions on his back and arms. This method also spread to Korean medicine, where their own secrets were added. Moxa was often rolled into small cigars and placed on the abdomens of infants for colic or on mothers after childbirth. Travelers who found themselves in Asia during the Middle Ages were astonished by the sight. Smoke billowed through the rooms, bodies were covered with burns, yet patients claimed they felt lightness and a surge of energy. In some monasteries, moxibustion was practiced on the ears to improve hearing, and on the crown of the head to drive away sadness and intrusive thoughts. Even today, in some regions of China and Japan, you can still find old masters keeping a box of dried mugwort and fine needles at the ready for the next session. But if the heat and smoke seem too exotic, the next treatment method involves real living creatures that no one would ever wish to see on their body. Leeches, the heroes of ancient medicine, why were they placed on the body? Strangely enough, throughout different eras, people have consciously allowed these small, slippery creatures to take care of their health. We're talking about leeches. These creatures were valued not only in Europe, but also in the East, North Africa, and even the Far East. The earliest depictions of bloodletting procedures using leeches were found in Egyptian tombs dating back more than 4,000 years. On papyri and bas-reliefs, priests are shown carefully applying the black creatures to the bodies of the sick, hoping to draw out illnesses along with the blood. In ancient Greece, Galen himself recommended using leeches for headaches, fevers, gout, and even to remove bad blood from the body. In medieval Europe, leeches became a true panacea. They were bred in special ponds near monasteries, and from the late 15th century, pharmacies sold entire pots of these living medicines. Doctors prescribed bloodletting for almost every minor ailment type: blood pressure, inflammation, swelling, dizziness. For a single procedure, between 5 and 20 leeches were placed on the patient's body, on the neck, lower back, behind the ears, or even on the inner thigh. Once the leech latched on, It was left in place until it filled up with blood. Sometimes these sessions lasted for an hour, and particularly hardy patients would wear leeches for several days in a row. In the 19th century, a true leech craze swept across Europe. The demand for medicinal worms was so enormous that in Paris there were entire farms where up to 30 million leeches were raised annually for hospitals and private homes. Doctors believed that these creatures could cure even pneumonia. Aristocratic women hoped to cleanse their skin and give their cheeks the fashionable pale look. After the procedure, blood would continue to ooze for several hours. It was believed that this was how impurities left the body. In the East, especially in India and China, leeches were used just as actively. They were applied to treat arthritis, purulent wounds, and venous diseases. Local healers noted that after a leech bite, the skin healed better and faster, and the risk of infection was reduced. In Russian villages, even in the 20th century, elderly women and folk healers would place leeches directly on the eyelids for styes or on the liver area during bouts of pain. In our time, scientists have discovered that leech saliva contains special substances that thin the blood and reduce inflammation. Thanks to this, some clinics are once again using these ancient medical heroes for post-surgical recovery and the treatment of varicose veins. But despite scientific validation, the method still seems creepy and frightening. After all, who would willingly invite little bloodsuckers onto themselves? But the next method of treatment takes us into a world of fire and mysterious smoke, where health and healing are directly connected to spirits and secret rituals. Smoke baths and spirits, shamanic healing practices. We immerse ourselves in the atmosphere of ancient forests and vast steppes, where smoke was not just the scent of a campfire but a true medicine. Among Siberian shamans, North American Indians, and the tribes of South American Amazons, smoke baths were considered an essential part of treating almost any illness. The procedure began with lighting a fire in the center of the hut, using a mixture of bark, herbs, and sometimes even pieces of animal fat. The patient was stripped to the waist, made to squat or lie on a mat, after which shields or hides were set up around them to keep the smoke from escaping. The shaman would take a bundle of dried sage, juniper, or cedar and begin to move it along the patient's body, chanting special incantations. In Alaska, the Eskimos used thick bundles of tundra grasses for the ritual, while in the Amazon jungle, they added ant leaves to the fire to make the smoke acrid and dense. It was believed that the smoke penetrated the lungs, cleansing them, driving out the spirit of illness, and filling the body with new strength. Smoke baths were especially often used to treat colds, fevers, and skin diseases. Sometimes these procedures lasted for several hours. In Jamaica and the West Indies, healers would gather teams of assistants. One person watched over the fire, another kept a vessel of water ready to pour over the coals and create steam. When children had a severe cold, they were completely wrapped in cloth and smoked over slowly smoldering herbs. At the end of the session, the shaman would approach the patient, spray a cloud of alchemical smoke from his own lungs, and clap loudly above the patient's head to seal the healing. In Africa, smoke baths were combined with rubbing the skin with special ointments and massaging in ash. In southern Africa, women would spend almost an entire day in smoke after giving birth to drive out the cold and recover their strength more quickly. Among the Native Americans of the North American plains, there was a separate ritual for seeking visions. Warriors would spend several days living in a smoky tent until they began to see guiding images that pointed the way to healing. If an illness was considered particularly stubborn, the shaman could summon spirit helpers. To do this, he would put on a mask made of bark and down, dance around the fire, and throw animal bones and flour into the flames. Sometimes powders made from rare minerals or crushed beetles were dissolved in the smoke. It was believed that this way the medicine would penetrate more deeply. Smoke baths and rituals with spirits are still practiced among the indigenous peoples of Siberia, Canada, and the Amazon, despite the development of modern medicine. But there were also other ways of fighting illnesses that northern peoples resorted to. Sometimes, in order to drive out disease, healers would resort to icy procedures, making patients literally freeze in order to overcome the ailment. Freezing out diseases. Secrets of Siberian cryotherapy. Finding yourself among the snowy expanses of Siberia, you can imagine how local healers have used the icy power of nature for centuries to fight illnesses. Cryotherapy, freezing of the body or its individual parts, became a real lifesaver for survival in the harsh conditions of taiga villages and yurts. In the accounts of 19th century ethnographers and travelers, there are stories of shamans who treated fever by covering the patient with snow or dousing them with icy water from a hole in the ice. Sometimes the patient was taken outside undressed for 20 minutes in minus 40 degrees Fahrenheit and made to rub their body with snow until the skin began to redden and burn. Yakut healers practiced ice wraps. The patient was wrapped in a reindeer hide, covered with a thick layer of snow on top, and then wrapped with another piece of fur. After half an hour, the body would go numb from the cold, but it was believed that the illness left together with the steam that rose when the patient was brought back into a warm room. Such wraps were used for joint inflammations, fever, and even abdominal pain. Sometimes, real ice steam rooms were set up in the settlements. Huge blocks of ice were brought into a small room, and the walls were rubbed with snow to keep the temperature as low as possible. The patient was undressed and seated directly on the ice, allowing the cold to penetrate to the bones. After 20 minutes of ice therapy, the patient was quickly brought into a hot hut, laid under fluffy furs, and given a decoction made from angelica roots. The accounts of the first European doctors who found themselves in Siberia were astonishing. Before the researchers' eyes, the locals treated burns and abscesses by applying pieces of clean ice or cloth soaked in icy water to them. They even relieved toothaches by holding a handful of small ice chips against the cheek. And for severe bruises and swelling, they made compresses from crushed snow to quickly reduce inflammation. It was believed that brief exposure to cold strengthened both spirit and body, dispelled harmful heat, and restored vitality. It was in Siberia that the tradition of ice bath shoals cut in the ice, where even small children were plunged for the sake of health, originated. There are accounts of shamans who could withstand temperatures as low as minus 50 degrees Fahrenheit to demonstrate their strength and protect the village from epidemics. Interestingly, modern scientists confirm that ice treatments really do help reduce inflammation and pain. Today, elements of cryotherapy are making a comeback in medicine around the world. But Siberians and their shamans had been harnessing the power of cold long before scientific theories emerged. But if ice could save people from illness, then the next method sounds like pure madness. After all, they propose treating pain with the most dangerous substance on the planet: liquid mercury against pain. How they try to treat with poison. If cryotherapy was frightening because of the cold, the next step put not only health but life itself at risk: treatment with liquid mercury. For centuries, alchemists, doctors, and healers from various countries truly believed that this shiny, silvery metal could drive out diseases, relieve excruciating pain, and even prolong youth. Back in ancient China, noble families used mercury sulfide powders, believing they would drive out evil spirits from within. Emperors of the Qin dynasty would wash down tiny mercury pellets with ginseng root infusions, hoping to gain immortality and get rid of headaches. Paradoxically, these experiments often ended in even greater suffering. After just a few doses, patients would develop a high fever and unquenchable thirst. In Europe, mercury became a symbol of the power of medicine during the time when the fight against syphilis reached epidemic proportions. From the 16th century, European doctors prescribed ointments, poultices, and even steam inhalations with mercury vapors. Patients were placed in special wooden cabinets where hot steam saturated with mercury would flow in through openings. In just 30 minutes, their skin would be covered in beads of sweat, and the patients would literally lose consciousness from suffocation. But it was believed that after mercury baths, ulcers and joint pain would subside. Some doctors prescribed rinsing with mercury water or gave intramuscular injections of metal compounds. In India and Persia, physicians prepared mercury elixirs to relieve toothaches and treat skin diseases. Patients took microscopic doses under strict supervision. Sometimes healers would carefully rub mercury into the gums to ease the pain of inflamed teeth. And in Persia, mercury powder was mixed with honey and rubbed into the skin for severe itching or eczema. In addition to this, there were attempts to treat fever. The patient was laid on an animal skin, and mercury was carefully dripped onto their back, then quickly rubbed in with a bone spatula. In the Russian Empire, pharmacies sold mercury ointments right up until the early 20th century. Even for childhood illnesses, including coughs and skin inflammations, mothers used mercury plasters, although doctors had already noticed dangerous side effects: severe poisoning, tooth loss, and in some cases even hallucinations. In English hospitals of the 19th century, mercury injections were considered a radical but necessary method for relieving the most severe pain. Despite all the suffering associated with liquid mercury, it continued to be used in attempts to cure diseases until scientists proved its deadly effects. But it's astonishing how many centuries people risked their lives to escape pain until other no less bizarre methods of treatment appeared. For example, sewing precious gold threads directly under the skin to make the body not only healthy but beautiful at the same time. Gold threads and jewels under the skin, beauty and health in a single procedure. After the dangerous experiments with mercury comes a method that surprises with its sophistication: the merging of beauty and medicine by implanting precious metals under the skin. As early as the mid-19th century, Russian, French, and Japanese doctors began experimenting with gold and silver threads as a means to combat wrinkles and chronic skin diseases. The procedure was frighteningly simple. The surgeon would thread the thinnest strips of pure gold, 6 to 12 inches long, under the skin of the face, neck, or hands with a needle, creating an invisible mesh in problem areas. A physician from St. Petersburg, Nikolai Filatov, was the first to document the use of gold threads for treating skin diseases and rejuvenation. And as early as the 18th century, the French doctor Charbonnet described how gold fibers were used to treat scars left by smallpox. In Asia, the procedure took on an additional meaning. Japanese doctors combined the insertion of gold plates with acupuncture techniques, believing that the combination of metal and traditional points could enhance vital energy and reduce inflammation. At the beginning of the 20th century, London cosmetologists began offering aristocratic women eternal youth through golden lifting. The procedures were performed in dimly lit offices where the faces of the wealthy were marked with the finest lines and then precious threads were inserted under the skin. In just a couple of weeks, the skin would become firmer. Even deep wrinkles were smoothed out, making the method a real hit among members of high society. Medical journals of that time noted that gold implants were also used for healing hard-to-treat wounds, strengthening blood vessels, and sometimes even for treating joint diseases in elderly patients. Silver also found its place in medicine. Thin platinum and silver threads were implanted in cases of chronic ulcers and infections, believing that these metals protected tissues from microbes. In Persia and the Ottoman Empire, special rituals involving precious beads were practiced. They were implanted into the skin of the back and shoulders, believing that stones and metals brought health and warded off evil spirits of disease. In India, a healer might adorn a patient's face with tiny sapphire dots set in a gold frame just beneath the thinnest layer of the dermis. With the advent of modern technologies, the method of gold stitching has evolved. Today, plastic surgeons use threads as thin as a human hair for skin lifting, while cosmetologists offer the implantation of microscopic gold plates to combat acne and allergies. In China and South Korea, biogold and bioplatinum have gained popularity. Lightweight alloys implanted into the chin or cheekbones to contour the face. Each of these methods, from the bone drills of ancient healers to the gold threads of modern surgeons, proves that the desire to conquer disease and prolong youth has driven people to the most incredible experiments. Sometimes the treatment seemed more dangerous than the illness itself, while at other times it brought salvation and even a new life, leaving behind not only marks on the body but also mysteries for the history of medicine.